Hey, this is Dr. Ryan coming at you from the Chiropractic Spa. Today we're going to talk about the different modalities that we use, or that I use specifically, to keep you engaged in the game and keep you lifting heavy throughout the rest of your life. So the first tool that I use, and this is the most superficial tool I probably use, is actually cupping. So a lot of people don't know what cupping is, or they haven't experienced it. You've probably seen it by now. So Michael Phelps kind of made this famous in the 2008 Olympics in, I think, Beijing, if I'm not mistaken. So Beijing, China. So you saw the little hickeys that came on his shoulder? Yeah, well, this is how you get the hickey. So it's literally a cup. Traditionally in China, they use glass cups, and they use flame and suction cup, and yeah, but I didn't want to start fires in my practice. So we use the pump here. So you actually attach this. It creates negative pressure under the cup, and that negative pressure pulls blood to the surface. And you can see you get a little red there. So what we want to do is pull that blood to the surface so that fresh blood flow can flow under it, and that increases and promotes healing. So once we get that fresh blood brings nutrients, brings oxygen, and those nutrients and oxygen help to heal tissues that may have been broken down over time. It's also a diagnostic tool, because we can see if you're darker under those, like the circles are darker under the cups, and when we release them, that means there's more inflammation present in the area. That means the blood, according to Chinese medicine, has been stagnant or sitting there for a much longer period of time. So the color kind of goes from pink to red to purple to like this dark maroon color. If you're in that dark maroon color like I am, there's inflammation. So we got to get rid of that inflammation. So we also use a lot of nutrient supplementation to help reduce that inflammation. So we have supplements in the office that we can use to help promote your recovery as well. So the second thing that I use is dry needling. So dry needling, we use actually acupuncture needles. So these are mid-sized. So we use acupuncture needles. They're great for getting deep into those muscle knots that have been nagging you for years and years and years. I have a buddy who's a professional Highland Games thrower. He had a nasty knot, a muscular adhesion right in his upper back, and we actually did some dry needling in there. He said he had been bothered with that for months, which, if you know anything about throwing, to complete the throw, you have to have extension of that shoulder. And if there's an adhesion from the rhomboid to the spine, you're not going to get that throw. You're not going to get that release. And so we had to get that knot worked out on him. And within one or two visits, he really was able to get a lot more motion through that shoulder just by releasing that knot. So we actually can penetrate deeper into the muscle tissue, which stimulates a few nerves within the muscle to relax and cause a relaxation response within the muscle. So that's the first step. The next step, if it's a really intense knot, or if you have a strain or a sprain or anything like that, this looks pretty crazy, but it is actually just a TENS unit that we can actually attach to the needles and create a stimulus within the muscle to create extra stimulus for recovery and promote recovery. I've worked with athletes with calf strains and things in the past, and this is a phenomenal tool to help recover faster, to stimulate muscle regeneration and muscle growth, and to stimulate recovery. So the other thing we do is we do a lot of myofascial work. My history is in personal training, then also obviously in powerlifting. I understand that the body needs to move, and joints have to move. Intersegmental joints need to move independently and as a unit. And so I use these it's called instrument assisted soft tissue mobilization. So these tools are called synergy tools. This is just one of the tools in the toolkit. I have about 5 or 6 here. And we use these to actually scrape the muscle and to release the fascia so that muscles can perform their function properly, and they can flow and move how they should, so that you don't have what's called reciprocal inhibition or any kind of muscular imbalance. So we find the muscles that are kind of lagging behind or may have been stuck over time, and we release them. So I'll do that. We also do a lot of stretching, a lot of mobility work to ensure that everything is performing its function properly and in sequential order, because not all muscles are supposed to fire in a particular order when you perform a movement. For example, when we do hip extension, the first muscle that should fire is our glutes. A lot of times the hamstrings take over and they go first because we're seated all day. So what we want to do is release those hamstring muscles, and we'll use all the tools we have to make sure that those hamstrings are not firing first, but they actually fire second. because we want the glutes to fire first, the hamstrings to fire second, and the low back to fire third. And so that's the distribution it should follow whenever we do hip extension exercises, which includes squat, deadlift, and if you're using your legs, you'll get a little hip drive on the bench, but not as much. So, but that being said, come on in, let us take a look at you, see what's going on, see how we can help you out, help you lift stronger, lift heavier, lift longer.